Hello guys, now we are going to see a adenoiditis topic in the first unit of medical surgical nursing. Adenoids. What do you mean by adenoids means? Adenoids are the small lymph of tissues located at the back of the throat just above the tonsils. In the throat, we are having a tonsils, right? So, just above the tonsil, a lymphatic tissues is present that is called as adenoids. Along with the tonsil, they are the first line of defense against the bacteria and virus. Adenoids are part of lymphatic system and adenoid stores white blood cells and antibodies. So only the adenoids acts against the bacteria and viruses. They are the part of immune system which helps fight against any infection. So adenoids are the lymphatic tissues which are present just above the tonsils and they are the first line of defense against the bacteria and viruses, and adenoids are the part of lymphatic system. Next, moving on to the what do you mean by adenoiditis? Adenoiditis is an inflammation of adenoids caused by any infective organism, either maybe bacteria or else virus. So adenoiditis is an infection and inflammation of adenoids, and adenoiditis is more common among the children. It is more common among the children. Next, what will be the causes for the adenoiditis means? The main causes are bacteria such as group A beta streptococci, group A beta streptococci, and the viruses includes Epstein-Barr virus, adenovirus and rhinovirus. These are the causative organism for adenoiditis. What are the risk factors means? The risk factors includes recurrent infection in the throat, neck and head, infection of the tonsils, and children are more susceptible to the adenoiditis comparing to the adults. So these are the causative factors or etiological factors for the adenoiditis. Next, moving on to the clinical manifestations. What are the clinical manifestations means? Nasal obstruction, difficulty to breathing through the nose, foul smelling breath, voice impairment, fever, sore throat, malaise, earache, snoring. These are the clinical manifestations of adenoiditis. So once there will be infection in the throat, we will be having a vocal problem as well as a breathing problem, as well as there will be a difficulty in swallowing and all. So only these clinical manifestations will be there. Okay, nasal obstruction, difficulty in the breathing, foul smelling breath, voice impairment, fever, sore throat, malaise, earache and snoring. Why there will be a earache means already in the previous videos I have told you that institutional tube will be connected to the throat and the nose. Throat and the ear, no? So when there is an infection in the throat, automatically we will be having a earache as well as itching in the ear. The diagnostic evaluation includes history collection, physical examination, blood analysis, throat swab culture and X-ray. In the history collection, mainly we need to gather regarding the previous history of any throat infections. Previous history of any throat infections like a tonsillitis or laryngitis or pharyngitis. And in the history we need to collect regarding the personal history, habitual history and any systemic disorders. Next, in the physical examination, we have to examine the throat, okay, to identify the infection. Next, in the blood analysis, we have to go for the complete blood count to analyze the leukocytic counts. Next, in throat swab culture, we are going to culture the throat swab to identify the causative organism and to make a line of treatment. Next, in the X-ray, we are going to check regarding the adenoid tissue. Next, moving on to the management. The management includes antibiotic therapy because the adenoiditis is the more commonly causative organism is bacteria. So only we have to go for the antibiotic therapy. It includes either penicillin or amoxicillin. Next, the patient will be having a fever, so we have to administer the antipyretics, that is paracetamol. And the patient will be having a pain in the throat as well as in the ears, no? So we have to go for the analgesic administration like ibuprofen or aspirin. Next, anti-inflammatory and corticosteroids we need to give. Then next, here nursing management. The nursing management includes complete assessment we have to do, and we have to monitor the vital signs because the patient will be having a fever as well as difficulty in the breathing. So we have to monitor the vital signs frequently. Then along with that, we have to provide a comfortable position, that is a Fowler's position we need to provide. Then we have to provide a lukewarm water and a salt to gargle, that will relieve the pain and itching. Then we have to provide a rest vocal, like the patient will be having a voice change, right? So we have to provide a throat rest. Throat rest means we have to advise the patient not to communicate, not to speak, or else not to talk loudly because throat pain will increase us. So only we have to provide a throat rest. Then as I told you in the previous videos, what will be the nursing diagnosis for the tonsillitis and all. I have mentioned the nursing diagnosis, no? Same nursing diagnosis we can formulate to this patient also, like hyperthermia related to the infection. Hyperthermia related to the infection. Next, pain related to the infection. Okay, pain related to the infection and difficulty in breathing. Okay, that also we can mention, as well as knowledge deficit and risk for complications also we can mention it. And related to these nursing diagnosis, interventions and all, I have told you in the previous video, that is tonsillitis video. You can refer the tonsillitis video for the nursing management. Thanking you.